parts. Till here it is 28 weeks, till here 32 weeks, and all the way up to xiphisternum it's 36 weeks. Now to see the fundal height, we start palpating from the xiphisternum using the ulnar border of our hand and see where we feel the fundus. So this is 32 weeks, but the patient is term. Why so? Because the flanks are full. Bulk of the baby is in the flanks. When the head goes down to the pelvis, flanks are occupied by the baby's body. So this is 32 weeks with flanks full. So this is a term size uterus. And now let us mark the fundal height by using a pen. So now to measure the symphysiofundal height in centimeters, we will have to ask the woman to straighten her legs first. So let's ask her to straighten the legs, and we take the inch tape here. Now the centimeter side should be away from our vision and the inches side should be facing you. So this is the pubic symphysis pubis here, and I place the inch tape here and then take it up to the mark which I had put, right? So the inches is towards me and I turn it over. This is 32. This is 32 centimeters. So 32 centimeters is our symphysiofundal height in centimeters and with flanks full. Okay, let's see it again. Measuring the symphysiofundal height. See, the centimeters side is away from your vision. This is 32 centimeters symphysiofundal height with flanks full. So this is a term size uterus. Now we have to do the Leopard's maneuvers, the obstetric grips. For that, you have to ask the woman to flex her knees and hips again with the knees wide apart, and that relaxes the abdominal muscles. Now the first 3 grips are done facing the patient. So checking the fundal grip now, I am palpating broad soft part like the buttocks, and then for the lateral grips you stabilize with one hand on one side and then do the grip on the other side. Like I'm here palpating the right side of the mother, so this is the right lateral grip. You look more closely. Here I am feeling knobby parts on the right side of the mother, suggestive of fetal limbs. And on the left side, I'm feeling a curved part, which is suggestive of the fetal backside. Now for the third grip, that is the pollic grip, we use one hand. We use one hand to grasp the presenting part. Now if the head is free, it is ballotable. But here the head is not free. Now for the fourth grip, which is the pelvic grip, right, we face the patient's legs, okay, and we take the 2 hands and try to dig here, you know, below the presenting part. We try to go beneath the presenting part with both our hands parallel to the inguinal ligament, as you can see, okay, but my 2 hands are not converging below the presenting part, right? That means that the head has gone deep into the pelvis, okay, that means that the head is most likely engaged. Now let us palpate the contractions, okay. Now for that you have to place one hand on the woman's fundus here and then feel the uterus. So like here the uterus is relaxed because I'm able to indent the uterine wall with gentle pressure by my fingers here. But when the uterus is contracted and there's hardening of the uterus, this indentation of the wall of the uterus will not be possible, okay, and the woman will complain of pain. So what did we see? Here are the buttocks, head is here, back is here on left side, limbs here on right side. So longitudinal lie, cephalic presentation, back on the left side. So occiput is also on the left side. So this is left occipito position. It could be transverse or anterior, left occipito transfer or left occipito anterior. We don't know as of right now. The confirmation of LOA or LOT, or for that matter occipito posterior position, will eventually be done by the PV examination. But the position of the fetal heart sound, where the fetal heart sound is heard with maximum intensity, will give us a very good idea about the position. In occipito anterior position, fetal heart rate is best heard anteriorly. In occipito posterior position, fetal heart rate is best heard at the flanks. Should I auscultate here? No. I will auscultate here because fetal heart sounds are best heard transmitted from the fetal backside. So in this case, on the left side. So where exactly should we auscultate? Now this is the umbilicus and this is the anterior superior iliac spine. Now, between these 2 points, let us imagine a spino-umbilical line, and midpoint here of this line, here is where one should auscultate for the fetal heart sound. So let me auscultate here. Now, as the head goes down into the pelvis, you see the fetal heart rate also moves towards the midline and downwards. Now, I can hear it here best. This means the head has gone down deep into the pelvis and it is LOA position, left occipito anterior. Now, let us hear with Doppler and auscultate for full 1 minute.